Welcome to the deep dive. Today, we're plunging into something many of us just see as pure relaxation hot springs.
Right, those places you go to unwind.
Exactly. And they're often talked about as having, amazing health benefits, boost immunity, help your joints, even good for the heart. Pain relief, too.
Oh, the good stuff.
Well, we actually had a listener get in touch with Professor Lin about this. She'd seen a Hot Springs Association website making some pretty big claims.
Ah, yes. I remember this query.
And she basically asked, is any of this actually true? Is it credible?
And that question really sets up what we're doing today. This deep dive is all about applying that critical thinking lens.
Looking past the glossy brochures.
Precisely. We're drawing on Professor Lin's research here to see what the science really says. Or, doesn't say.
So separating the facts from maybe the persuasive marketing?
That's the mission. We need to look at the evidence for these supposed benefits, and importantly, uncover some risks that often get, well, completely ignored.
Okay, so this association website, it sounded quite convincing, maybe charts and things. What did Professor Lin find when he started digging?
Well, the first thing that jumped out, and this is like critical thinking 101, was the total lack of citations.
No references.
At all. None. They listed all these benefits but didn't point to a single study to back them up. As Professor Lin said, that makes them opinions, basically, not scientific fact.
Regardless of how nicely presented they are.
Exactly. So he went looking himself at the actual scientific literature. Hundreds of papers.
Okay.
And the picture was, well, very different. A few studies hinted at some potential benefits, sure, but most found insufficient evidence. Or worse, they pointed towards potential harm.
Harm? Wow. Okay, that's a stark contrast then. So it's definitely not all just harmless warm water.
Far from it. This is where the academic debate really kicks in, looking at the downsides.
What kind of risks did Professor Lin uncover? This sounds important.
He found some really significant concerns, actually. For example, studies from Taiwan repeatedly. One back in 2007 found Legionella pneumophila. That's the bacteria causing Legionnaire's disease, the severe pneumonia.
Yes, absolutely. That's serious.
They found it in 21% of the hot spring results they tested. 21%. And you can get it just by inhaling the steam, the contaminated mist.
Just breathing it in?
And it's not just theoretical. There have been actual outbreaks linked to hot springs, like in Japan, people getting fevers, severe breathing problems. Tragically, some even died.
Wow. Okay. Legionnaires is definitely not something you associate with a relaxing spa day. Were there other bugs?
Unfortunately, yes. Another Taiwanese study looked for enteroviruses. These are viruses that can cause, well, a range of illnesses and pose real public health threats.
And they found them.
They detected various types in over a third of the recreational hot spring areas they sampled. So it's bacteria and viruses we need to think about.
This is sobering. What about the claims around heart health? That's one you hear a lot, good for circulation, cardiovascular system.
Right. Professor Lin looked into that too, specifically studies on balneotherapy. That's the term for therapeutic bathing.
Okay.
And it's complex. One recent study from 2023 actually advised against long hot spring baths in summer, said it increased the burden on the heart.
Increased it.
And in winter, it cautioned about big drops in blood pressure. So timing and season seem to matter a lot.
That makes sense. Temperature differences.
And then there was a study on radon hot springs.
Radon? Isn't that radioactive?
It is. And a known carcinogen causes lung cancer. Now, the study did associate bathing in those springs with some relief for hypertension, but, you're weighing that against cancer risk. It's a major trade-off.
Definitely a complex picture there. Okay, so lots of cautions, lots of potential risks. Was there any good news? Did Professor Lin find any areas where the science even a little promise?
Yeah, it's important to be balanced. It wasn't all negative. Some studies did offer, let's say, intriguing hints, even if they weren't slam dunks.
Like what?
Well, one newer study found that bathing in hot springs at night seemed to be associated with better blood pressure control in older adults.
Interesting. Nighttime specifically.
And another suggested that long-term bathing might correlate with better sleep quality.
Okay, sleep and blood pressure. Anything else? Maybe for joints, like the original claim?
There was a review back in 2009 looking at rheumatic diseases. It suggested balneotherapy might be linked to improvements. But, and this is crucial, it concluded the studies just weren't strong enough to say for sure.
So, hints, possibilities, but not solid proof for those big claims.
Exactly. Preliminary findings at best, often qualified.
Right. So recapping here, the big claims from the association just didn't hold up under Professor Lin's scrutiny.
Not really, no.
We've got some hints maybe about sleep or blood pressure, but they're tentative. And balanced against that are these really quite serious documented risks. Legionella, enteroviruses, cardiovascular strain.
Precisely. It paints a much more nuanced picture than the simple hot springs are healthy message.
So what was Professor Lin's final take? Does he avoid them now?
His conclusion sums it up perfectly, I think. He said he wouldn't go out of his way to find a hot spring specifically for health benefits. But, if he's traveling and there's one there, he enjoys it.
Okay, so enjoying it for what it is, relaxation, but not expecting medical miracles.
Exactly that. And the vital lesson here, for all of us, is to always question health claims, especially when there's no research cited. Understand the full picture, the good, the bad, the uncertain before you dive in, literally or figuratively.
Demand the evidence.
Demand the evidence, which really brings up a crucial question for you, the listener. In this world absolutely saturated with health advice, how can you consistently apply this kind of critical thinking? How do you sort the genuinely beneficial from what's just really clever, persuasive marketing?
That's a really powerful thought to end on, something we hope you'll carry forward. Always question, always seek the evidence. Thanks for diving deep with us today.